this is just an example of a few different companies, that do next generation sequencing. And these are some of the companies that focus more on what we call the somatic or non-inheritable mutation. So looking again at the biology of your tumor. So some of these companies like Tempus or Foundation or Caris or 360DX, will help get you a result. And typically, the turnaround time to get results once the tissue biopsy is sent off or the liquid biopsy is sent off from the blood sample is roughly around 14 days or so, sometimes even less. So I think that's something that we're continuing to work on. Then, we have companies that really focus on those inheritable types of mutations. And sometimes a lot of our genetic counselors who we work with very closely, the ones that will ask you, about your family history and things like that, use different companies like Invitae and Ambry Genetics to figure out and look at a wide variety of different genes, that can be passed down and that are known. So I think these are two other companies that we tend to use. So one question for you, Jacob, talking about, the somatic mutation companies and the germline mutation companies, is this something that, all cancers need both somatic testing and germline testing? Do they need one or the other? What sort of situations, I guess, would you do both?
Yeah, so just to back up one step, I think when somebody says Foundation or Caris or Tempus, what they're really saying is next generation sequencing. That's kind of the topic of today's talk, and
Right.
just so that everybody's clear, sometimes not always in clinic do I say that, do we get the NGS on our patient's tumor, right? We'll say, do we have the Foundation report? And we're really talking about the NGS. And just so that's clear, I think does every cancer need Invitae or Ambry Genetics germline testing, right? The hereditary syndrome testing. I don't know. I think at some point we may get to a point where everyone gets those. I think now there are more stringent guidelines about who is at higher risk to have these kind of genetic syndromes. But I think the science is evolving. So I think right now at the end of 2023, we're not quite at a point where everybody
Sure.
needs all of the tests all of the time. But
Right.
I would say every person with, metastatic stage 4 cancer should get a somatic testing, right? One on the
Right.
last slide,
Mhm.
one of those tests, if feasible. I think that
Definitely.
absolutely should be, part of the treatment strategy.
Definitely. No, I agree. And I think definitely, when you're talking about one's family history, and talking about individuals that, have multiple family members, with breast cancer, or, other similar related cancers, like pancreatic cancers can sometimes be related to breast cancers through the BRCA gene and things like that. So I think, talking to your oncologist really about your family history, I think is very important, and to discuss whether or not you need germline testing or not. I wholeheartedly agree with you about, all stage 4 cancer patients getting, somatic or that, non-inheritable testing, because that gives us the true biology of what's going on with your cancer and best sort of, show us, what treatment options are available to you. And also, sometimes in people that, have stage 1, 2, and 3 cancers, for example, in lung cancers and things like that as well, we may discuss doing, that somatic or non-inheritable testing as well, because it's actually incorporated into a lot of the treatments now. So that those are some considerations, but definitely when you're talking to your oncologist about all these different tests, just talk to them about your family history. I think is the big point there. Um, so this is an example of a next generation sequence report that we wanted to show you guys. That's from Tempus, and it basically, what we're looking at really is we're looking at someone that has lung cancer, and essentially, you can see that there's a lot of different, little letters here that represent different genetic mutations that are detected on this patient's tumor sample. And, as you can see, there's one highlighted here that says somatic potentially actionable. And what that is basically saying is that this KRAS gene is one cancer or one type of genetic mutation we see in lung cancer, and that it is what we call potentially actionable, meaning that it has a potential treatment for it. And if we look at looking farther into the report, we can see that, this KRAS mutation does have an FDA approved treatment with this medication called sotorasib that is approved by the NCCN, or one of the national cancer guidelines. And it's something that, can be discussed with the patient about whether or not, that treatment may be a good treatment for their lung cancer, essentially. So this is sort of an example of what the report looks for us as oncologists to sort of understand what treatment options are potentially available based on the patient's different biology and genetics of that tumor we talked about. That's somatic testing. And then the last thing, that we see with this next generation sequence report is that there's also a list of clinical trials as well, that can be available to patients, based on, again, the specific type of biology and the genes that were picked up on that first part of the report that we showed you guys, is basically showing us different clinical trials that are always out there that sort of show us how far they are from you or where you are, and the potential genetic mutations that they're looking for in the clinical trial as well. So I think that's also a very powerful tool for patients to have this information and have a copy of the report so that they know exactly, what are the potential treatment options that my oncologist is talking about. But again, are there other treatment options for me at another institution potentially? Because we in oncology always say that some of the best treatments out there are clinical trials, because this is how we drive the field moving forward, and finding new treatments for individuals. So this is something that patients should have this information and be empowered to talk to their oncologist about different clinical trials as well.
Matt, if a report comes back and it doesn't have any mutations on it, how do you interpret that? Does that mean that somebody's cancer is not driven by any mutations, or what do you take? Because that happens every now and then, right?
Yeah, definitely, without a doubt. And I think that is a something that, unfortunately can't happen a lot, and I think that that's something that, I think it's still very important for patients to have that information as well, and your oncologist to look at, these different genetic mutations that may be reported or not. A lot of these mutations may have treatments in the future potentially. And so a lot of these platforms like Tempus and others essentially update their results. And as a result of that, there may be a new clinical trial that may be waiting for you for a new treatment that may be approved, a year or two after, or 6 months after. So it's sort of a changing, field. And I think that we always want to make sure that even though there may not be what we call an actionable mutation or a mutation that may have a treatment for it, then we also want to keep an eye on things and see exactly, whether or not there's, other clinical trials that may not be listed on here as well. And then also, if, treatments change and new treatments are approved, I think that's where it's really important to have that information.